Good morning. It's Wednesday morning, March 25th, 2020. I'm State Senator Bob Guida, and I'm here to present information about what's going on at the state level with regard to the COVID-19 coronavirus crisis that we're facing as communities, state, and nation. Though I'm not part of the executive branch, and that's the branch that actually implements the orders and the procedures and policies that are being taken to deal with this crisis, I am in contact daily with our officials at the highest levels of the executive branch when individual situations reach the crisis point. As an example, last week the Woodsville Ambulance Service was running very short of personal protection equipment. Cottage Hospital reached out to me. I contacted New Hampshire's Director of Homeland Security Emergency Management, and within an hour a solution was in place. I'm also working to get supplies to places of greatest need in a small way, because obviously we each need to be doing what we can, and I want you to know that I'm trying to do my part for you as well. Later this week I'll be delivering 5-gallon containers of hand sanitizer. Those containers are being made in New Hampshire by a business that repurposed its entire production line to help with the shortage of sanitizer. Very important in terms of the hygiene requirements to try to stop the spread of the COVID-19 virus. Plymouth, Tilton, and Meredith will receive these supplies. Each will get a 5-gallon bucket. And I've also emailed all 27 towns and all the school districts in Senate District 2 to let them know that I'm available 24 hours a day, 7 days a week, to connect them with resources that they may need when they experience a crisis. Each of us is part of the solution to the COVID-19 problem. Right now, the most important thing we can do is to follow the Centers for Disease Control guidance to flatten the curve and slow the spread of the coronavirus. Wash your hands frequently, practice social distancing, keep a 6-foot distance as a minimum between you and others. If you have a cough, a fever, or shortness of breath, stay at home and call your doctor. If you have a serious underlying health condition that can put you in an increased risk, stay home and stay away from other people. State government has stepped up to the plate. Governor Sununu has implemented 2020 Executive Order 4, which declares a state of emergency, and so far 16 emergency orders to address different aspects of the pandemic. I'm pretty certain that more will be coming as the crisis evolves. Those orders are, of course, the Executive Order 2020-04, declaring a state of emergency due to the novel coronavirus. Emergency Order 1, temporary remote instruction and support for our schools, K through 12. I'm happy to report that most of our schools have made that transition almost seamlessly. A few minor technology glitches, but everything seems to be working well as our students are being taught at home and preventing, again, the spread of the virus by practicing social distancing. Emergency Order 2, prohibited gatherings of 50 or more attendees and on-site beverage consumption. Emergency Order 3 says that all providers of electric, gas, water, telephone, cable, VoIP, internet service, and deliverable fuel services are prohibited from disconnecting or discontinuing service for non-payments for the duration of the state of emergency. Emergency Order 4 states that landlords are not allowed to start eviction proceedings for those unable to pay due to their financial situations. That would be against the law, and all judicial and non-judicial foreclosures have also been prohibited during the state of emergency. Emergency Order 5, relative to individuals who are unable to work or have reduced hours due to the COVID-19 pandemic, and provides them immediate access to unemployment benefits. I'll discuss more about that a little bit later, because I think it's important to share with you some of the details, as many, if not most of us, are now staying home because businesses have been closed and our education establishments as well. Emergency Order 6 deals with temporary authorization for the takeout delivery of beer and wine. Restaurants, diners, bars, saloons, private clubs, and any other establishments that have both a restaurant license and an on-premise license from the Liquor Commission are temporarily authorized to allow for takeout or delivery of spirits. Emergency Order 7 temporarily modifies data and privacy governance plans. Emergency Order 8 temporary expansion of access to telehealth services to protect public and healthcare providers. And that's really important. As you know, at the state level, we've been advancing the telehealth initiatives to try to make it easier for remotely located patients and providers to connect and provide necessary medical care, and this will accelerate that process. Emergency Order 9 establishes the Emergency Healthcare System Relief Fund. Governor Sununu appropriated $50 million because a number of our critical access hospitals, the smaller hospitals located in remote regions of the state, as well as major hospitals, many of which have stopped elective surgeries and significantly reduced non-emergency appointments, are obviously suffering the effects of that cash flow crunch. And so we've established the $50 million fund to help those hospitals, especially in dealing with healthcare providers that are on the front lines of this crisis. Emergency Order 10 requires all sellers of groceries to transition temporarily to the use of single-use paper or plastic bags. Emergency Order 11 is a temporary authority to perform secure remote online notarization. That's important because we're trying to do minimum damage to transactions like real estate sales and any other transactions that would require a notary to sign and witness. So that gives them that ability to do that online. Emergency Order 12 temporarily modifies public access to meetings under RSA 91A, and that's the right to know law. We'll talk about that a little bit more later because it's very important. It's very relevant to the continuance of governance as we experience and work our way through this problem. Emergency Order 13 is a temporary allowance for New Hampshire pharmacists and pharmacies to compound, that's basically to mix, and sell hand sanitizer over the counter, and to allow pharmacy technicians to perform non-dispensing tasks remotely. Again, we're trying to keep the medical functioning of our system operating as best we can as we operate under the social distancing order. Emergency Order 14 is a temporary authorization for out-of-state pharmacies to act as licensed mail-order facilities within the state of New Hampshire. Again, we're expecting a surge at some point of, or just the continuation of normal pharmaceutical prescription drugs. And so again, this will facilitate that and enable us to use out-of-state resources as well. Emergency Order 15 is a temporary authority for out-of-state medical providers to provide medically necessary services and provide services through telehealth. Again, expanding the available network of providers for healthcare services to out-of-state providers as our people begin to experience this COVID-19 and other health ailments. And finally, Emergency Order 16 is a temporary prohibition on scheduled gatherings of 10 or more attendees. That would go back and modify Emergency Order 2, which had set it at 50. Now the limit is down to 10. I want to talk a little bit about Emergency Order 5, dealing with unemployment. Individuals who can't work or have reduced hours due to the COVID-19 pandemic will have immediate access to unemployment benefits. Anyone in the following situations are eligible. If your employer temporarily closes due to COVID-19, if you need to self-quarantine or are directed to quarantine at the instruction of a healthcare provider, employer, or government official, if you need to care for a family member that has COVID-19 or is under quarantine, if you need to care for a dependent because of school closures, child care facility closures, or other types of care program closures, and self-employed individuals that are temporarily unable to operate their business because of the above listed situations will also be eligible. I'm going to provide at the end of this a synopsis of websites and telephone numbers to enable you to access the agencies and the information that I'm reading and get it in more depth as well. Individuals will need to file for each week of temporary unemployment. All of this can and should be done online at www.nhes.nh.gov or by calling 603-271-7700. Do not go to the offices because the unemployment offices are closed, again, in an attempt to flatten the curve and prevent the spread of the COVID-19 coronavirus. The Department of Motor Vehicles has made some changes, again, to try to keep down the number of exposures of their people and the public as well. Temporary plate extensions are as follows. All 20-day motor vehicle and dealer plates issued after March 1st are automatically valid through April 30th. So you need to do nothing other than have that plate to get this extension. If you're traveling out of state, however, and we should try to minimize that, but if you are, because you need to, check with the state you're traveling to or through to make sure that they'll honor a potentially expired temporary plate from New Hampshire. Interesting to know, this does not apply to registration renewals that are done at the local level. You should call your town or city hall for guidance on that issue. As far as license renewals, if your driver's license is due to expire, you can get a temporary 6-month extension. You do that by calling 603-227-4020. Again, that's 227-4020. You'll be required to verify your eligibility and your identity over the phone. Typical renewal fee will be charged and a 6-month license will be mailed to the address on record. If you receive these temporary licenses, you'll then have to visit DMV in person as that license expires to get the permanent license, which is valid for the remaining 4 or 5 years, and you'll receive that license at no charge. This process, however, does not apply to commercial driver's licenses, CDLs. It's an important distinction. With regard to the state legislature, we've been in recess for 2 weeks, and we're currently not scheduled to reconvene until at least April 10th. This creates a significant challenge to completing our work within the deadline set by House and Senate rules, and those will probably have to change when we do reconvene. We can't yet establish a new schedule because we don't yet know the extent of the pandemic in New Hampshire, and obviously assembling 400 representatives, 24 senators, 5 executive councilors, and the dozens of staff in the State House will create a significant risk and the possibility of spreading the disease from a central location here in Concord on out to all the districts that we represent. The number of infected persons in New Hampshire is increasing daily. Unfortunately, we have no idea as far as the rate of infection in our population, because what we're seeing is that the increased number of tests that are being administered is delivering the increased number of infected people. It's going to take some time to gather that data, and again, it's very important to do the best that we can in social distancing, washing our hands, and remaining indoors as much as possible and avoiding travel to prevent the spread and to flatten that curve. With respect to RSA 91A and municipal boards, it's very important to note that that statute, RSA 91A, has been modified by Emergency Order 16, and those modifications are extensive. A lot of detail, so I'm not going to go into it on this public access announcement, but I would encourage you to visit the New Hampshire Municipal Association website, and across the top of their homepage is a banner that talks about COVID-19 measures that have been taken, and one of those, of course, will explain RSA 91A, the right to know law, which is critical to transparency in the operations of government. Again, we want governments to do the best they can to comply with social distancing and hand washing and all those items. But in those instances where you can't meet together, then the policies and procedures have been established by the emergency order and clarified by the municipal association. So I encourage you to visit that if you're a member of a public board. In closing, neither our nation nor our state of New Hampshire, nor frankly the world, has ever before had to curtail economic activity and essentially stop the economy to fight a biological threat. And make no mistake, this is a biological threat. There aren't any clear statistics worldwide yet on the severity or the fatality rate, but we do know that in places like China and Italy, it is very severe, and what we want to do with the best of our ability is to stop that from happening here. We have the best technicians, we have the best of technology, the scientists, the doctors, and they're doing their very best at both the national level and in our state Health and Human Services, at our epidemiologists, and the executive branch is very involved with the Homeland Security Emergency Management folks kind of acting as a clearinghouse for the many requests for additional supplies of masks and gowns and caps for our providers. But we can and we will overcome this crisis by working together. It's what we do as a nation when the chips are down. It's what we do best here in New Hampshire. We take care of each other, and although we may be inconvenienced, and I'm sure many of us are, we deal with that. I would encourage you individually to get out and take a walk, go out and get out of the house, but again, we maintain the social distancing, and use some physical exercise to dispel some of the stress that we're going to experience by being kept out of reach of those with whom we normally associate both in work and in play. The measures we've asked to implement certainly intrude and disrupt our everyday lives, but working together we can overcome this crisis. We'll get back to business as normal as quickly and as safely as we can. And again, remember those measures. Wash your hands, keep the social distancing. If you're sick, call a doctor if you're experiencing symptoms. And together we will overcome this crisis. It's an honor and privilege to serve, and I thank you for giving me the opportunity to do that.